Diolaze by InMode uses an 810 nanometer diode laser to effectively target and treat hair for safe, fast, and permanent hair removal results. When used, the diode energy penetrates to the root of the hair follicle to heat and disable its growth. The unique scanning mechanism of Diolaze allows for a large area to be treated with very little discomfort and at a fast speed. Legs and back can easily be treated in a fraction of the time of other laser devices. Comfort, efficacy, and speed are key to Diolaze's hair removal success. Most fast diodes on the market cannot maintain the speed or high peak pulse, but Diolaze's scanning configuration allows hair removal to be done without compromising speed or efficacy. The Diolaze applicator looks like this. This is the large cool plate. This is all for cooling, pre, parallel, and post-cooling. This is the treatment window and the scanner including the diode crystals. This is the treatment window width that you can visually see on your applicator as you are doing the treatment. Pre-treatment. Avoid any tanning 3 to 4 weeks prior to treatment, or use at least 30 SPF sunblock. Shave hair and ensure that the skin is clean. Apply a thin layer of clear ultrasound gel to the treated area. Test spot with normal to weak cooling to see endpoints and change to strong cooling while treating. After testing, wait a few minutes for response, with a longer time on darker skin. After the treatment is finished, you can remove the gel and wipe the skin and check for positive endpoints. You should see perifollicular edema. This is a positive endpoint showing that the treatment setting was effective. You should see little red bumps, and sometimes during treatment, if the hair is coarse enough, you'll smell the burnt hair. After testing the skin to ensure the patient is a good candidate for hair removal, you can begin treatment. The number of treatments is typically varied from 5 to 10 sessions every 4 to 8 weeks. As treatment proceeds, the intervals become longer. There are longer intervals for body hair, 6 to 8 weeks, than for facial hair, 4 to 6 weeks, in the first 3 sessions. In subsequent sessions, the intervals on the face may increase to 8 weeks and on the body to 10 to 12. Legs may require 15-week intervals. Lighter and deeper hairs, as well as hormonally controlled areas such as the chin, are more resistant and may require more treatment sessions. The best timing for additional session is when hair regrowth is observed. When treating the face for hair removal, ensure that the skin is clear of lotion, oils, makeup, or any debris. Once the skin is clean, we can apply clear ultrasound gel to the area. You can use a tongue blade to apply the gel. Only a thin coat is necessary when performing Diolaze. On the face and neck, avoid villous fuzzy hair. Whenever doing any Diolaze treatment, protective eyewear should be used for the patient and the operator. Higher fluence settings can be used for lighter skin, fine hair, and lighter hair. Please ensure you consult with the quick reference guide. Do not treat the upper eyelids, lips, or permanent makeup. When treating the chin, ensure that there is full contact with the treatment window with the skin. Orient the handpiece in a way where full contact is achieved with the tip. Contact can easily be achieved with the placement and the orientation of our applicator. Now, the entire perioral region, chin, and area underneath the chin has been treated. When treating the underarm area, ensure that the patient has shaved 1 to 2 days prior to the treatment, and ensure that the skin is clean and dry. Once again, we can wipe the skin clean with mild soap and water and follow it with alcohol to ensure that there is no deodorant or lotions or oils. If treating a patient that has deodorant, you can have a skin reaction including a rash or bumps. Once the area is clean, we will apply clear ultrasound gel in a thin layer. You want to let your patient know you will be applying cold gel. The patient should be wearing protective eyewear as well as the operator. Always start with a low fluence and change gradually according to patient tolerance and skin response. To treat the underarm area, use a thin coat of clear ultrasound gel. Apply the gel to the entire treatment zone. The Diolaze applicator should be positioned where the larger cooling plate is leading the way. This will pre-cool the area for better patient comfort. The entire tip, including the treatment window, is cooled. To use the Diolaze, press the foot pedal, position the applicator flat on the skin, and then press on the applicator trigger to start treating. Refer to the quick reference guide for proper energy settings before treatment. In a single mode, move handpiece by stamping with minimal overlap. Apply pressure on the skin, then pulse. Auto repeat can be set, and this treatment area is finished. To treat the arm, apply a clear ultrasound gel over the treatment site. Because the patient's arm is small, we can orient the handpiece traveling up the arm, or we treat the arm going across. Apply pressure and ensure that treatment window is completely covered on all 4 sides of the applicator window. You can pre-cool the skin with the applicator when pulsing. We make small movements, and you can glide along the skin and pulse all the way down your treatment area. As a reminder, avoid any tattoos or any areas with moles. Post-treatment recommendation. Sunblock should be used for 3 weeks following the treatment. Moisturizer may be applied after each treatment. Makeup may be applied immediately after facial treatment if skin is intact. To treat the leg, apply a thin coat of clear ultrasound. This treatment will be in fast auto repeat. The direction of the treatment will follow the large cooling plate. Remember, operate the Diolaze so that the large cooling plate is pre-cooling the treatment area. Treatment can be across the leg or up and down depending on what is more comfortable for the operator and the body part of the patient. Apply pressure to the skin and pulse using the treatment window guide. This treatment is set to a repetition of 1 Hz. On the Diolaze applicator casing, you will notice a blue LED light. This light reflects the movement of the scanning diode and where the laser energy is being dispensed from the applicator window. When treating over the shin bone, orient the handpiece so that full contact of the skin is maintained. You can change the pulse repetition from auto repeat to single pulse for areas that are sensitive or require more complex hand positioning. As you become more familiar with treatment, you will be very comfortable treating an auto repeat in most areas. Diolaze is a very comfortable, high-fluence treatment even over bony areas. Now that the shin area is treated, reorient the handpiece and begin treating again to get the full length of the leg. Now the entire front of the lower leg has been treated, and the patient can turn over to treat the back of their legs if required.